Now you know the latest terminology and possible causes of sleep-related infant deaths. Next, let's talk about what you can do in your child care program to make sure the infants in your care stay safe while they sleep. The American Academy of Pediatrics has several safe sleep recommendations. An easy way to remember these important safe sleep practices is A, B, C. Babies should sleep alone, on their back, and in a crib. Please listen carefully as we go over each of these in more detail. Knowing this information could save the life of a child in your program.
There are many factors you should consider for this aspect of safe sleep. Let's consider the A and the ABCs of sleep alone. Most obviously, babies should always have their own surface to sleep on. For example, you should not place them in a crib with another baby. Having more than one baby in the same crib or sleeping area increases the chance that both infants will overheat. This can lead to sleep-related infant death. One infant may also accidentally block the breathing of the other, which can cause accidental suffocation. You have a responsibility to practice the ABCs of safe sleeping and to supervise infants while they sleep. You should never sleep while the infants in your care are sleeping. Also, you should never fall asleep while holding an infant. It may seem natural to put a toy or stuffed animal or a blanket in a baby's crib to comfort them or keep them warm while they sleep. This is not a safe practice. Soft objects like pillows, toys, blankets, and non-fitted sheets can cover the infant's face and block their airway. This can lead to accidental suffocation, strangulation, or rebreathing. Rebreathing is when an infant breathes in too much of their own breath and does not get enough fresh oxygen. When loose bedding and soft objects are put in an infant's sleep environment, an infant is 5 times more likely to experience sleep-related infant death. An infant's sleep area or crib should only have a well-fitted sheet. To ensure that an infant's body temperature stays at a normal level while they sleep, the American Academy of Pediatrics recommends dressing the infant in layers of clothing. Covering them in blankets or using a hat can lead to overheating. Consider the temperature of the room. Dress the infant in no more than 1 extra layer of clothing than what you would feel comfortable wearing. If you ever notice an infant's skin is hot to the touch, red, or sweating, then the infant is too warm. Take off a layer of clothing and check to make sure the baby is cooling down. Swaddling with a sleep sack or similar products is a technique that's sometimes used to calm infants and promotes sleep. Sleep sacks are considered safer than swaddling a baby in a blanket. If the blanket is wrapped too tight, it can restrict the baby's circulation. And if the blanket is too loose, it can come off and cover the baby's face. The safest option is to swaddle with a sleep sack. Importantly, swaddling should no longer be used when infants show signs that they will start rolling over soon, usually around 3 months of age. This typically occurs around 3 to 4 months of age for most infants, but for some it might happen even earlier. An infant rolls over while swaddled in a sleep sack, it's hard for them to roll back over if their breathing becomes blocked by the crib mattress. Weighted swaddle clothing or weighted objects are not safe and therefore not recommended. Finally, having soft bumper pads along the slats of a crib is no longer a practice that's recommended. In the past, the space between crib slats used to be wide enough that an infant's head could become trapped between them. To prevent this from happening, many people use soft bumper pads around the lower portion of the cribs. Today, however, crib standards require that crib slats be closer together. This eliminates the need for bumper pads. Bumper pads increase the risk of an infant sleep-related death. If an infant rolls too close to these bumper pads, their airway could become blocked, leading to suffocation. Their face could also become trapped between the mattress and bumper pads. The bumper pad ties also become wrapped around the infant's neck, leading to accidental strangulation. For these reasons, an infant's sleeping area should be free from bumper pads. To summarize, the A of safe sleep, each infant should sleep alone. Here are some important points to remember in keeping a sleeping baby safe. An infant should have their own sleeping surface or crib. An infant's crib should be free of soft objects like toys and blankets. To avoid overheating, an infant should not be overdressed or covered with blankets. Swaddling should be discontinued once an infant begins showing signs of rolling. Crib bumper pads should not be used.